50,000 Americans, many critically ill, are on a national waiting list for a kidney transplant. They depend on dialysis until they find a matching donor. But now, as health and medical correspondent Sarah Lee Kessler reports, a Mount Laurel man has found another option.
A lot of people praying for us.
55-year-old Andrew Weber, who has polycystic kidney disease, desperately needs a transplant. His kidneys have shut down.
I'll be on the list for at least another 3 to 4 years. And so the reality is that dialysis to me was just not an alternative.
Andrew, whose wife Rita is 36, is used to leading an active life. So the idea of being tethered to machines for 4 hours every couple of days, no way.
Just no way.
I caught up with the Webers on Monday at Jefferson University Hospital in Philadelphia, where Andrew was being readied for transplant. There was an extra preoperative step involved, something called plasmapheresis.
Basically, we're hooking Andrew up to a machine which will separate out the antibodies that are in his blood from the rest of the blood.
Plasmapheresis is critical in this case because Rita is the donor, and this loving couple is a complete mismatch, at least when it comes to blood type.
I'm AB positive and Andrew's O negative, so we're the exact opposite across the spectrum. He's the universal donor and I'm the universal acceptor, which is the exact opposite of what we should be to make it a perfect match.
Yet in other ways, Dr. Ratner says Rita is an ideal donor. She's young, healthy, active, has no underlying disease, and is at minimal risk for complications from anesthesia. On Tuesday, Andrew became the first patient in our region to undergo an ABO Incompatible kidney transplant. The first step in this 5-hour operation, removing his spleen, the main site of antibody production, then transplanting one of Rita's kidneys. He's also receiving higher doses of anti-rejection drugs.
Although this has rarely been done in the United States, there's a very large experience in Japan.
According to Dr. Ratner, several hundred incompatible transplants.
They've been doing this for about 15 years with outstanding results.
This unconventional method is really the extreme of what we ought to be seeing more and more of, and that is people donating their kidneys to loved ones.
Well, I guess it's partly a Valentine's Day gift, but I look at it as a gift of life and a gift of freedom.
Andrew's gift to Rita, a platinum bracelet symbolizing the special way they're now linked. Both Webers remain hospitalized in good condition. Sarah Lee Kessler, NJN News, Philadelphia.